You walk into the room and smell something off. You check the litter box, and it hits you. Your cat has diarrhea. Maybe it's just one time. Maybe it's been going on for a few days. Either way, it's gross, it's messy, and it makes you worry. Because diarrhea in cats isn't just an inconvenience. It's a signal, and your job isn't to panic. It's to figure out what's going on, how serious it is, and what steps you need to take next. First, let's get one thing out of the way. Not all diarrhea is an emergency. But not all diarrhea is harmless, either. The key is understanding your cat's patterns and knowing what to look for. So what actually causes diarrhea in cats? The list is long, and that's part of the challenge. It could be something as simple as a sudden change in diet or a new treat. Or it could be something more serious like parasites, an infection, food intolerance, inflammatory bowel disease, or even organ dysfunction. Let's start with the most common cause, dietary changes. Cats are extremely sensitive to what they eat. If you switched your cat's food recently, even to something better, and you didn't transition slowly, that might be the cause. Their digestive system needs time to adjust. Abrupt changes often lead to loose stool, even if the food itself is healthy. The same thing can happen if they got into something they weren't supposed to, like dog food, scraps from the table, or even a piece of plant they chewed on. If your cat's diarrhea started within 24 to 48 hours of a food change, and they're otherwise acting normal, eating, drinking, playing, grooming, then that might be all it is. In those cases, it's okay to monitor for a day or two. You don't need to run to the vet immediately. Just stop any treats, table food, or new additions. Stick to a simple, familiar diet, and make sure they're drinking enough water. But what if you didn't change anything? What if it just came out of nowhere? Then you start thinking about parasites, especially if your cat is young, recently adopted, or goes outside. Parasites like roundworms, Giardia, or coccidia can live in the digestive tract and cause persistent or intermittent diarrhea. Sometimes you'll see mucus or a bit of blood in the stool. Sometimes it just looks soft or watery. And even if your cat looks fine otherwise, those parasites can be doing long-term damage inside. A fecal exam at your vet's office is the only way to know for sure. You can't always see the worms yourself. And over-the-counter dewormers are often too general or too weak to fully clear an infection. If your cat has recurring diarrhea and hasn't had a fecal test in a while, that's a smart place to start. Now let's talk about bacterial infections. These are less common, but they do happen, especially if your cat eats raw food, hunts outside, or is exposed to contaminated water or surfaces. Salmonella, E. coli, or Campylobacter can all lead to digestive issues, and they can be dangerous, not just to your cat, but to you, too. If your cat has diarrhea, a fever, and seems lethargic or refuses food, don't wait. Those are warning signs that this isn't a mild issue. Call your vet. Your cat may need antibiotics or fluids, depending on how dehydrated they've become. Speaking of dehydration, let's stop and talk about what diarrhea does to the body. Every time your cat has a loose or watery stool, they're losing more fluid than normal. And cats already have a low thirst drive. That means they're more likely to become dehydrated quickly. Dehydration in cats can lead to kidney stress, fatigue, dry gums, and eventually organ damage if it's severe. So how do you know if your cat is dehydrated? One way is to check their skin. Gently lift the skin at the back of their neck, like you're forming a little tent. Then let go. If the skin snaps back quickly, hydration is probably okay. If it stays tented or moves back slowly, that's a sign of dehydration. Another indicator is their gums. Gums should be pink and moist, not dry or tacky. If you suspect dehydration, even mild, it's time to call your vet. At the very least, they'll want to check vitals and possibly administer subcutaneous fluids to help your cat stabilize. And don't wait until it's obvious. With cats, obvious is often already too late. Now let's address a question many cat owners ask. Can I treat my cat's diarrhea at home? That depends on the situation. If your cat is otherwise acting normal, eating, drinking, using the litter box, and showing no signs of pain, it's okay to take a step back and try a short-term bland diet. Think of it as a reset for the gut. You can offer a simple protein like boiled chicken or turkey, no seasoning, no bones, skin removed, and a small amount of plain canned pumpkin, not pie filling, just 100% pure pumpkin. The fiber in pumpkin helps firm up stool by absorbing excess water in the gut. Some vets also recommend probiotics, like Fortiflora or other feline-specific products, to restore good bacteria in the gut. But this isn't a magic fix. If your cat continues to have diarrhea for more than 2 or 3 days, or if things get worse, then it's not something to manage at home anymore. What about kittens? Diarrhea in kittens is always more urgent. Their bodies are small, and their hydration reserve is limited. What looks like a mild issue can turn serious within hours. If a kitten has diarrhea, especially if they're lethargic, not nursing or eating, or if their gums look pale, get him to a vet. Don't wait, don't guess. Older cats, too, are more vulnerable. If your senior cat starts having diarrhea out of nowhere, it could be a sign of an underlying disease, like hyperthyroidism, kidney disease, or even cancer. It's not about age, it's about changes that need to be investigated. There's also inflammatory bowel disease, or IBD. This is a chronic condition where the lining of your cat's intestines becomes inflamed. It can cause soft stools, weight loss, vomiting, or changes in appetite. Sometimes it mimics food sensitivity. Sometimes it looks like stress. But it doesn't go away on its own, and it can only be diagnosed through lab tests, sometimes even a biopsy. If your cat's diarrhea comes and goes, or they've been treated multiple times and it keeps coming back, IBD is something your vet may explore. Treatment often involves a special prescription diet and medications to calm the inflammation. It's manageable, but it has to be diagnosed properly first. So let's circle back. Your cat has diarrhea. What do you do? First, stay calm. Don't panic. Watch closely. Is your cat acting normal otherwise? Are they eating, drinking, playing? If yes, you can monitor them at home for a day or two, especially if you recently introduced a new food. But if your cat is vomiting along with diarrhea, if there's blood in the stool, if they stop eating, seem weak, or aren't using the litter box properly, then it's time to call your vet. Don't give your cat over-the-counter human medications. Things like Pepto-Bismol or Imodium can be toxic to cats. Even if they seem safe for dogs or people, cat biology is different. Always talk to a vet before giving any kind of medication. And document everything. Take photos of the litter box. Track how many times your cat goes. Write down what they ate, what changed in their environment, and when the symptoms started. This helps your vet get a full picture, and helps you spot patterns you might not notice otherwise. Sometimes it's a one-time thing. Sometimes it's the start of something more serious. Either way, you don't need to guess alone. Your job isn't to have all the answers. It's to pay attention, act early, and trust your instincts. Your cat depends on you to notice what they can't explain. And the faster you respond, the faster they recover. If this helped you feel more confident about what to do next time diarrhea shows up in the litter box, subscribe. Because cat health is all about what you notice, and how you act when it matters.